I work in the field of peripheral nerve repair. So reestablishing sensation and motor function to extremities in patients that have had mastectomies, right? That's a very large problem is women end up losing, they become insensate in the chest. That is psychologically really damaging for the women because, if you can't feel that hug, that becomes very psychologically detrimental, but also just for protective sensation. We've had unfortunate patients that have come in with burns because they just didn't know that they were burning post mastectomy. So, we find these patients now, one of the interesting things I'm looking at is gender affirmation, where medicine is meeting the contemporary culture and understanding more about gender identity and helping these patients to really sort of solidify their gender identities. My task is knowing what's in our portfolio of things that we can do and employ to help ensure appropriate nerve repair, and then what are interesting procedures that are on the horizon that I can help to champion with surgeons.